medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
You might think there is a difference between turmeric versus curcumin, and why should you not even consider the word nano curcumin, nano-particularized curcumin? Well, there is good reason, and I'm going to try to help you understand the difference between these three entities. Even though close, there is still a marked difference. Hi, I'm Dr. Mitch Ghen. Let's talk about turmeric benefits first. It contains curcumin with other beneficial compounds, and it's used in traditional medicine for pretty much its healing properties. The problem is that turmeric has very low bioavailability. It can cause allergic reactions in some people. And of course, this low bioavailability, although it makes it a very good herb and tasty herb, it does make a difference to try to get it into the bloodstream in such levels that would actually create some sort of good effect. And we'll talk about some of those effects in a moment. Curcumin, on the other hand, is the active ingredient in turmeric. It's powerful anti-inflammatory and antioxidant properties. And it has a potential to improve symptoms in many different diseases like arthritis, depression, and even cancer and Alzheimer's. I use it a lot. But again, it runs that bioavailability challenge. Curcumin is also poorly absorbed into the bloodstream, and it doesn't maintain its level there. So different manufacturers came up with ideas of how to enhance its absorption. One of them is using piperine, pretty much a pepper derivative that can increase its absorption to about 2,000%. The other is using something in a fat solubility area, which is taking curcumin with a high-fat meal, which also improves its effectiveness. Now, again, low bioavailability is making it difficult, and high doses of curcumin do have some gastrointestinal consequences for some individuals, and it can interact with some medications. Now, when I use it, and often I use it in patients that do have neoplasia, I'm using very high doses between 5 and even 12,000 milligrams. So how do you enhance absorption? Well, they were the things we talked about earlier, which is the piperine and things of that kind of nature. But then there's something called nano curcumin. And I love the nano curcumin. It basically is a nano-particularized substance which does cross the blood-brain barrier. And if you're looking to remove amyloid and neuroprotection, it may be the form that best helps new neurons improve memory, reduce neuroinflammation, and protect against memory loss. Nano curcumin pretty much holds the most promise in preventing cognitive decline. And for me, it seems to be the one that has the best replication of reducing inflammation as an antioxidant. If I did it side by side, which I have in my own little test market, I find that curcumin is a wonderful addition to pretty much any therapy that involves anti-inflammation or neurologic consequences or cancer, etc., or arthritis. But when I put it side by side with a nanoparticularized compound, there is a remarkable improvement and difference between the two, nanoparticularization winning out. For more information, please contact me at Dr. Mitch at drmitchghen.com. That's DRMITCH at DRMITCHGHEN.com. Thanks so much for watching.